COVID-19 hasn't gone anywhere, and the recent Omicron subvariant BA.2 has local health officials concerned. Our Adriana Alexander explains what you at home can do to prepare for the surge that may come.
COVID-19 talk has slowed down for many people in the past few weeks, but health officials want you to know we are still in the middle of a pandemic, and the Omicron subvariant BA.2 is causing some concern. COVID treatment clinics founder Dr. James Taylor says a surge could be on its way.
It seems like we can take a kind of a nice deep breath. We're kind of over this Omicron surge, but I am concerned about what's happening in China and in Europe with the BA.2 variety coming back and causing another secondary minor surge in the next maybe month or two.
Since at-home testing became available, it's been difficult for health officials to keep track of total cases.
It's interesting to me because we really don't have a sense of how many people are doing those tests. Again, there's no requirement for them to report it. So it is going to alter. But before the home test, we pretty much had data on any positive tests from whether it be a pharmacy or a hospital or clinic, et cetera. That's going to change here going forward.
Numbers of COVID cases in Tom Green County have slowed down recently, with 50 current active cases and 1 death this week. Whether the number of cases gets better or worse, health officials are still advising people to get vaccinated, stay active, and isolate if you feel any symptoms.
It's still important for people to be aware of COVID and still take those precautions.
Absolutely. So I think it's kind of that balance of risk reward. You have to assess your situation. If you're in a high risk group, you may want to hold off on really kind of engaging in the new normal and getting back out in the community as much as younger people could. And so, this is the time to continue to be vigilant because the virus is still out there. We're still seeing patients come to our clinic getting sick and dying from this virus. So even though we say the surge is behind us, it's still very real and still affecting people considerably.
Adriana Alexander, Fox West, Texas.